Okay, so the squat, that's why we're all here. What is the ideal squat position? Now, there is no ideal squat position, but there's three important factors that people often want to know about. How deep should I squat? What should my foot position be? Oftentimes we hear toes should be facing forwards. What happens if we turn them outwards? Does that mean we're going to hurt ourselves? And then the width of the feet, should we be shoulder width, hip width, or wider? Does it matter? And the answer always is it depends on the person. So there's two things that depend on to determine what your squat should look like. So the first is anatomy. So here on the left we have our typical hip joint. There's two important factors of the hip joint: the hip socket, which is on the pelvis, and then the ball that goes into it from the femur or the hip or the leg bone. So as you can see here, this is what the actual hip anatomy looks like in cadavers. So there's, as you can see, the one on the left, can you guys see that okay? The one on the left has a lot deeper of a hip socket with more bone over, like coming over the front of the hip joint. Can we all kind of visualize that on ourselves? So if I'm that hip joint right there and I'm going into full flexion, I'm more likely to hit bone before the second hip joint is. Does that make sense? Now below would be the ball portion of the hip joint. So angle of the femur head can also determine where our squat position should be. So as you can see, the first femur is going like straight into the hip joint, and the other one is angled a little bit differently. Now for both of them, we're still looking down on the hip joint, but really angle can play a big factor in the ability to squat. So the tough thing is sports like CrossFit with movement requirements to go below parallel, this doesn't always work for everyone's hip joints, so we have to figure out the best way to get your hip joint into that position. So there's a lot of movement requirements for the squat. Stability-wise, we require a strong core, our glute muscles need to be strong, and our hamstrings need to be able to counterbalance the quads. For mobility, we need to have good mid-back extension, hip mobility, and ankle mobility. Ankles are often forgotten about, but we're going to do a screen on each other today to see what our ankles can and can't do. Oops, sorry. Okay, so what is mobility? Now this is a word that often gets thrown around a lot. So let's go back to the anatomy of the hip joint. Each person's hip joint has a certain ability to move based on the bony anatomy. So you go in to see me in the clinic, and I determine what does your anatomy feel like and what is your mobility based on that. So your mobility is ideally your potential to move through your joint's entire range of motion. So that means the flexibility of the muscles around the joint, the way you've trained, that will change your mobility. And we want to optimize each joint's range of motion, but sometimes if we sit all day in like a flex position, it's going to be a lot harder for us to extend our joint when we stand back up because we haven't required our joint to go through that range of motion. So mobility is something we can train, but it's also something that we can make better. So you can see the picture on the screen. On the left, that was in 2011. This person had not great mobility, not terrible though, but then he worked on it and look how deep he can squat and how good it looks. Stability is just our ability to stabilize the joint throughout the different ranges of motion that it possesses. So if I have really good shoulder mobility here, can I hold a really strong dumbbell in that position? That would be my stability of the joint. So to optimize your squat, you need to understand your personal anatomy. You need to work on your mobility and stability, and you need to identify if there's anything else that's limiting it, like an injury to a soft tissue or a muscle or something like that. So we are going to go through 3 mobility screens together, but we'll do that at the end. There's a couple things I want to talk about. The butt wink. Has anyone heard about this? No. Okay, we have 2 people that have heard about the butt wink. Raf, do you have a butt wink? Can we look at yours?
I know it does.
Okay, actually, KP. This will be good. Okay, so KP is going to squat facing facing this way, maybe turn a little bit so everyone can kind of see. So squat down as far as you can. Okay, so everyone kind of looking at his pelvis here. What's happening? So come up a little bit higher. So here, what happens there?
Tucks under.
Yeah, so his tailbone tucks underneath. We call that the butt wink. So basically, sorry, go up a little bit. So he has a completely straight back here, and his hip mobility is changing. So it's getting deeper into hip mobility. He has reached full potential of his hip flexion, and now his pelvis has to tuck under. Thanks, KP. So the butt wink is something that's very debated in the training community because it really depends on a lot of different factors. But if KP was butt winking here and is going deep into his squat, I would be really hesitant to load his squat. But how often is he really down here in his squat? Not very often. So butt wink really helps us determine, are you going to injure your low back? And if you have low back pain, we're more likely to be looking at your butt wink because that is when your back flexes. And we have to be careful with loading that position. Does that make sense? We can change the butt wink by increasing the hip mobility to make sure that he has full potential to reach flexion before his butt winks under. Okay, so low back injury and squatting. So it's a result of a couple things: poor technique, bad programming and training, or lack of stability. So poor technique would be butt winking in a really, really heavy squat, not being in the right position, like this guy with the really heavy weights. He's not really utilizing his anatomy very well. His hips are in a bad position. He's putting a ton of weight through the knees. It doesn't look good. And if you start training with someone and you've never done a loaded back squat or a front squat and they throw a couple 45s on the bar, your body doesn't have the stability or the mobility requirements to stabilize in that position. Okay, so that's really all I wanted to cover today, but we are going to do 3 important screens. So we'll do that after RAF talks.
Question.
Yeah.
Can you talk a little bit about knees?
For sure. So knees are usually the things that are going to be injured in your squat because if you don't have the mobility requirements of the hips and the ankles, it's just going to put pressure through the knees. So oftentimes when someone comes in with knee pain with squatting, I look, what are their hips doing in their squat? What are their ankles doing in their squat? Because if for example, for me, I have to squat with my toes out a lot, and that's my best hip and ankle mobility. But if I was going toes in, like I'm going to be putting a lot more forces through the knees, whereas the knees should kind of just go with the flow. Does that make sense? So I always am looking at hip mobility and ankle mobility first. Yeah, and if you look at the biomechanics of a squat, load is going to go completely down through the body. So if we go back to that picture of that terrible squat, the load is going to blast right through that guy's inside of his knee there. Know what I mean by that? Whereas if his knees were able to be turned outwards, it's going to go straight down into the ankles where we want them to be. Make sense?
Yeah.
Okay, Raf. Yes.
So interesting enough, this is why I love working with Sarah's because we're always thinking on the same lines and literally have exactly the same pictures, which is going to be amazing. But I love to adapt with things like this. You guys already saw that. Where am I? Funny enough. So talking about different kind of squats, the one actually what I'm going to start with is asking you guys. I'm going to show you 2 different types of squats, and I want you to let me know which one's wrong or right. So if I squatted like this, is that right or wrong? Or if I squatted like this, is that right or wrong? Thoughts, questions? What do you think? It depends. Honestly, yeah, it depends, right? This is where kind of that slide with all the different types of pelvises. It really, really depends on your anatomy. So me being Eastern European, I have those Polish hips, as I call them, where I can live and breathe down here, right? And whereas someone in general population that maybe has a North American hip where they kind of just get stuck here. Getting them to go all the way down here with load, probably not going to be the best thing. And I'll actually throw like a curveball. Say I have a barbell on my back and I decide to do, I don't even know what the squat's called, but you go onto your toes and let the knees come forward. Is that a bad thing or a good thing? Like, what do you guys think? It is dangerous, but again, it depends, right? So say I train myself just body weight, being able to do this over and over again, and I have no pain and I'm healthy, my joints move properly, loading it to a certain point might be okay. Like, again, it really depends on the individual, but for the most part, general population, like, I would never do that because it's just going to screw crap up a lot. But there's always exceptions to the rule, right? So like someone like this, probably going to injure themselves. If your squat looks like this, you're probably going to injure yourself. If you're doing squats like this, 100% you're going to be hurting yourself. And this is actually a real thing. This is not like someone staged it. So someone was at a public gym and the personal trainer was training their client and they were doing that. So, pardon my language, but this is what I call gym fuckery. And I don't stop these things because I want to see what happens. Because I'm like really curious. I'm like, what are you trying to achieve? This is what like exercise is to me. Like when I look at an exercise like this, I'm like, okay, what are we trying to achieve here? And I 100% if I ask the question to that coach, he'll be like, oh, we're trying to build stability and like get stronger with your legs. I'm like, okay, what's the risk over reward in this scenario? Because like if something goes wrong, like this guy's gonna be flying off the ball or the ball's gonna pop, right? Kind of going back to anatomy and like getting into a barbell back squat, I kind of look at that as like cream of the crop. Like you need a lot of prerequisites to get there, kind of like what we were talking about, the barbell deadlift. And for the most part, a lot of my clients shouldn't be barbell back squatting because a lot of them are like, they live in this nature. And now it's like, okay, let's place a barbell on your back and suck this in and now put your whole spine into load when they're sitting on their butt all day like this and they can't even do this. But you see it all the time in gyms where people like force themselves into this posture with the barbell and it kind of looks like a melted candle and they come back up and they're placing like 45 plates on each side and they're nowhere near depth and they're like, why does my back hurt? It's like, well, look at your squat mechanics. And like Sarah already kind of covered this with the hips, but like the one thing I want to say is if you look deeply into these little sockets, this one kind of comes straight down where this one goes laterally. So the person sitting beside you has completely different hips, right? Your left hip socket is going to be different than your right hip socket. If you've had kids, that's going to change your anatomy. If you sit all day, that's going to change how you squat. If you had an injury and never took care of it, that's going to change how you squat. Like every little bit of pieces that revolve around those hips are going to play a huge role in how you squat. And on top of that, like we haven't even really touched on knees, ankles, like thoracic extension. There's so much to it to how to squat. And I think I'm just going to blow past the next thing because like literally the next thing I put up is how those hips look again and then showing how the femur sits into the hip socket. But there's like things like fascia that we haven't covered, people feeling tight, neurological tone, like all these things matter when squatting. But the nice thing is like, we're bringing up all these points and it almost seems like, oh shit, maybe I shouldn't squat at all. But there's always like light at the end of the tunnel to get better. It's just you need to actually practice to get there. And like one point that I always kind of make to clients getting into the barbell lifts is like when you look at countries like China, they're doing really well in Olympic lifting. When you see them like in slow motion, their form is perfect. Like even under the heaviest loads that's breaking world records, their form is perfect because they kind of started their young athletes that you need to earn your weight to be able to actually lift X, Y, and Z. So it has to be perfect every time. Whereas you look on the West Coast side of the hemisphere, where it's kind of like just put as much weight on the bar and hope for the best. So if you look at injury rates on the US side and Canada side compared to China, like it's skyrocketed because they're trying to always keep up. But other countries have figured out things like recovery and things like that. And a lot of key players in our industry that do really, really good stuff with athletes are now being contracted out to work with China, which is a really smart move. But the big thing for us today is going to be kind of getting into the trenches and figuring out what's going to work best for you and figuring out like the best stance with the assessments that we're going to be doing with Sarah, and also we're going to do a little kin stretch warm up to see if that changes anything. Because a lot of times it's like when people come to work out, you sat all day, they've been like super depressed at work, and there's a lot of factors, and then they come in kind of just like bound and tight. But then that's the purpose of a warm up. Sometimes a lot of people come in cold and they're like, hey, I'm just gonna like squat 135 for my warm up. Doesn't really do anything. So you can change how your body moves really, really quickly with a proper warm up designed specifically to you. And I find like kin stretch, what we're gonna do today for like 10 minutes, is gonna change a lot of things of how you move and feel, and kind of go from there. Questions, thoughts, concerns? Yeah, 100%.
I know what it is.
Okay. Even though with the sun out. So let's, do you want to do the assessments first?
Yeah.
Okay.
Okay. First one is going to be ankle mobility. So we're going to head over to the wall anyways. Will they have to come back?
No, but you can put that on because you can run them through.
Okay, great. Okay, so everyone's going to come on over to the wall. I'll show you. Okay, so we're going to get into kind of a lunge position. So right now I'm testing my left ankle mobility. So I'm just going to put my hands on the wall. I'll start with about an inch away from the wall. It doesn't really matter what your back leg's doing. All I'm going to do is keep my foot completely on the ground and tap my knee to the wall. And then I'm going to move it back a little bit, tap my knee to the wall. Move it back a little bit, tap my knee to the wall until I can't anymore. You're going to create like a visual mark, and then you can compare it to the other side and see how far each foot can go. So see, that would be about my limit on the right side, and as you can see, I'm about 2 inches over my toes, which is all right. Rafs would be better, of course, but okay, so let's pop a squat on the wall here, and I'll try and look. You guys seem like you know what you're doing. Sorry, we tried to move all the down plans.
So the thing that you want to look at
Okay, do you feel any tension in your back here?
Is your knee going directly straight, or is it going off to the side, going off to the middle? Where do you feel tight? Do you feel a pinch in the front, in the back?
Come up a little bit more with your foot.
So all these things matter, and a lot of people, when I put them through
So let's see if that's your spot
the
there.
ankle
Now
mobility,
let's bring
like,
this
test
foot
to
up.
see how much range they have. A lot of people want to cheat by lifting that heel. So if you want, you can even take off your shoes, because a lot of shoes have a heel left in
That's
them.
about your.
And another like
You're
thing you can do is with
lacking
your
a little bit of mobility, so that would be a good area for you to look. How are you doing, Annie?
in the front of your toe, and you should be able to roll past it without the heel popping out.
So
So that would be like a
that's
pass for ankle mobility. It's kind of hard to do it on yourself, but if you like put the 4 fingers in front of the wall and kind of had a
oh, that's pretty good.
imaginary
And let's
line
compare with the
at
other
top,
side.
that would work a lot better.
That's okay. All good. I touch feet all day.
Okay.
Yeah, any big discrepancies side to side for anyone?
A lot tighter.
Yeah.
And my calf.
Okay, so did anyone, like, yours was a little bit limited, sorry to point yours out, but was anyone else's, like, not able to get more than, like, an inch or 2 away from the wall? No?
So kind of make a mental note of what your left and right ankle mobility is, because it's going to pop up later today when we start squatting.
Okay, next one we're going to do is a simple hip flexion. Now, ideally, we'd be elevated on like a treatment table, but basically you're just going to lay on the ground. You're going to bring your foot up to your chest and see how high you can bring it. So if you think about yourself squatting, so I'm here, and I tip myself over, I'm still kind of in like a squat position, right? See how high I can get my hip flexion to go without it pinching or hurting. So if I go this way, it pinches and does not feel good. If I go this way, I can flex my hip up a little bit higher. So we're just trying to see where we feel it. Also, if I'm going like this, obviously, like keep the other foot down, okay? And it's just to get an idea of how much tension do you feel. Do you feel tension through the glutes? That would be what I was talking about earlier, like a soft tissue restriction. Try different positions too, where your foot's straight, coming straight up, or if it's pointing outwards a little bit. So let's get that other foot straight. Yeah, good. Good, so you got good hip flexion, not bad.
Again, might not be a bad thing.
Yeah, I was gonna say, see if one side's less than. Okay, okay. KP's got some soft tissue restrictions, I'm sure. On the left. Okay, what if you bring yourself into a bit more like external rotation?
Tend to feel better if their knee comes out to like more to like.
Yeah, so you probably are like a toes out type of person. So again, check side to side, see how high you can go. Camila has really good hip sockets, kind of like Raf. I've looked at both of them in the clinic, so I know. So this would be Camila's anatomy. Look how deep her anatomy would allow her to squat. Does she have the mobility to squat that deep, though? Probably not, right? So maybe she could work really, really hard and squat that deep if she really wanted to, but I'm guessing she can't. So, okay, last one we're going to do is to look at everyone's butt wink. So maybe partner up for this one. You're going to go on all fours. Now, I want you to start in like a basic squat position. So again, I'm just tipped over. I'm still in my squat position. Let's do knees shoulder width apart, toes tucked under, and then you're just going to try and keep your back straight as you squat down lower until you get like a tuck under like that. And try to see how far you can go. Does that make sense? So we're trying to see at what point you have a butt wink. Okay, you might have to help each other out for this. How are you doing, Sandy?
Good, yeah.
Are you watching?
Yeah, up there.
Yeah, and then you tuck under. So try with knees a little bit wider. Yeah, perfect. So now your butt winking a little earlier. So that's too wide, right? Yeah. And like it's gonna feel very different for each person. Okay, you're kind of going down a bit. I want you to stay up. And just think of like rocking back onto your heels. There you go. Yeah, and you tuck just about there, but you're below parallel. That's still pretty good. Try with your knees really close together, just so you can feel the difference.
But you know that she can do this no problem.
So can you feel the difference in the hips when you do that?
Yeah.
Yeah, it tucks earlier.
Yeah.
So you would run out of hip mobility at that point. You actually have pretty good hip sockets for that, though. How are you guys doing over here?
I'm sorry, I can't winches.
Oh, Annie's an anomaly. We all know that.
So this is why it's so specific to
So she kind of starts tucking there. So come back up. I want you to push the ground away with your hands. Yeah, and you can move your head up a little bit more. Yeah. Okay, now let's just start rolling back. So that's actually pretty good. And see,
Kind of taught me there.
yeah, so she's pinching a little bit on the left there. So she's almost limited by her hip anatomy and not as much her pelvis, right? But did you see how wide her legs were? Like if she were to come closer, so let's try with a close one. Yeah. Now let's walk. So see, she's tucking under already. What does that feel like? Oh, it feels okay. Interesting. She's just very rounded in this one. It's not as blatantly obvious on her. Did you check out your own as well? Okay, come on back up. Let's go knees a little bit wider.
I look at goals, right? So maybe to
There you go.
mobility,
Yeah, so she's kind of, so you can just go below parallel a little bit, but I think if we worked on your ankles, you would be able to get that squat depth. The next thing we do, you'll be able to recognize a bit more, just to get the feel for different positions, right, and how it impacts your pelvis. So, well, your hip pinches, so that would be an anatomical limitation, or like something that you would probably need treated. But it's just like comfort level in the different ones. Like I feel like you just need to watch it on me, maybe. Like I can already feel my back flexing with that. But look how narrow that is. Like I know I can't squat that narrow. So it just shows the difference in the pelvis in various positions. Now I know I can squat deep, but it's because I have good hip mobility, right? So,
Okay,
Yeah, it's mostly just for squat depth.
Okay,
Just so you can
squat
see
depth.
what happens in the back.
So in theory, I can squat decently until my hip pinches.
Exactly.
Right.
And then it shows you how squat can you deep when you stand up and all the other factors come into play. Probably not as deep as
that.
exactly, but that's the potential you have, right?
Okay, sorry.
All good. Oh, it's
Okay.
my turn?
Yeah.
Cool.
So now we're going to do an assessment, a proper warm-up for all the right areas for the squat, and then a retest.
Yes. So we're going to go on the wall. What we're going to do is the face the wall squat. And what I want to see is maybe 4 inches away from the wall. And what I want to see is hands up to the side. I don't want your face touching the walls or the knees touching the walls or you like doing one of these to cheat. So you're going to go as low as possible into your squat without cheating and then come back up. Wherever you stop is just remember that point because I'm really kind of curious to see like when we go through an actual warm-up how much that actually changes.
So we want to stop when our knees touch?
Stop where you can't go any further because like some people will get to a point where they're going and they're like, that's it. Or they'll get to a point where they're like, okay, I'm going to fall over behind me, right? So go slow, do a couple reps, and kind of find that point where you kind of get stuck. So again, 4 inches, eyeball it. Go into a position in your squat that you normally squat in and see where you kind of stop at. Yeah, it does. But it depends on the person, right? Like,
The kind of shoes that come
ooh, yeah. So after a couple reps, kind of make a mental mark in your head where you stop in your squat. About 4 inches. Yeah, right about there.
As far as I can go?
Yeah, if you can keep going. Yeah.
Some further? Should I stand closer?
No.
Because you were like, and then you kept going way, way further.
They'll keep like if you can go further, if you can go all the way to the ground, that just like because this I also use this as an assessment sometimes to see where, yeah, probably around there. Like again, like you did.
Before I feel like I'm over here. I'm gonna remember that point. But I felt like I stood wider.
Is that what you would usually use as a squat? Like your squatting stance? But that's fine because like we've done a couple tests and now you kind of know where it feels more comfortable. Yeah, so like you play around with that. If you went closer with your toes straight, it's gonna be a lot harder. A lot harder. Right? So like the reason why a lot of people like to go feet out, because now it's less ankle mobility necessary to actually get there. If they go toe straight, you're going to need more dorsiflexion, more hip mobility to actually get there, right? And then on top of that, if you had like powerlifting shoes where they have a natural heel to it, it's going to be even easier. That looks pretty good. But it's also like, I haven't seen it yet with all you, but sometimes I've seen people cheat this if they know how to cheat with their like torso. Because I see a lot of times people will get to a point where they get stuck and then they start arching with their back to get a little bit further. And I've
Think of that person going straight into their 135 warm-up back
Yeah.
squat. They're going to be, not really using the muscles that they need to be.
Just like you did.
So try to get it with arms down though, because that's another thing. If you go hands up, that's a whole other piece that.
Cheated, totally.
But hands down, yeah. Got a little bit more depth. Because now it's like if you bring arms up, like you now have to fight with like shoulder flexion, extension through your T-spine, and some. Yeah, like. So let's move the benches out of the way, and we're gonna start with some little kin stretch warm up before we start back squatting. Nice and easy. What we're gonna do, we're gonna get into a 90-90 position. So you're gonna start with the feet kind of wider than hip width. And what I want to see is you're going to drop both legs to one side to mimic that 90-90 position. So this is kind of a base position I put a lot of patients and clients in, because now we're going to work both external and internal rotation of our hips. So what I want to see, we're going to work external rotation first. So we're going to rotate our torso so our belly button's in line with that front knee. And what I want to see you do in this position, we're going to hold it about for 2 minutes, and then we're going to do some awesome stuff from this position. So I want you to think of tilting your pelvis, so you're like arching your lower back, and I want you to lean forward into that front hip so you feel like a deep capsular stretch in your glute, butt, whatever you want to call it. So when you find that stretch, I want you to hold it and start using your diaphragm to breathe, to kind of reinforce to your body that this is a safe position to be in and it's not going to reject it. So we're going to, again, hold this for 2 minutes, and then we're going to get into something called pails and rails. Before I get into that, does everyone feel the stretch? Yes? Yes, then that butt. But again, it also depends on the person. You can also feel it in the trailing hip if you're super tight. And if that's like really uncomfortable, pinchy, you can slide the back leg in and it'll make it a little bit easier. If that's not the issue, then you can stay here. So what we're going to do in this position after that 2 minute mark that I'm counting in my head, I'm going to do something called pails. So I want you to think of driving your knee and ankle down into the ground. And I want you to imagine that there's a scale right on your shin bone. And your job is to push down as much pounds of pressure into it that you're trying to literally break that scale. So when I tell you to go, I want you to ramp up a pails contraction. I don't want you to go 0 to 100 really quickly and you're like, holy crap, this is hurting me. You're going to start off slow, and by the 10th second when we're finished, I want you to like go maximally, like thinking like you're doing a heavy back squat. So that 10th second should be pretty difficult. And then what we're going to do from there, you're going to ease off from the contraction, and you're not going to go, oh man, that was hard. You're going to hang out here. You're going to try to get further into the stretch, but I don't want to see this happen. I don't want this. I want you to constantly have your chest out and leaning forward and shoving your butt behind you as far as possible. Then from there, we're going to do something called a rails contraction, where we're going to do the opposite. You're going to drive your knee and ankle off the ground, while at the same time you're trying to drive your chest down to the ground, so we're closing the gap as much as possible. If at any time you lift this leg off, you're doing it incorrectly. You want to be able to contract this without lifting it up. Any questions before we do this? I know that was a lot. So all you need to think about, when I tell you to go, you're pushing your leg into the ground. When I tell you to do a rails contraction, we're pulling it off the ground.
Any numbness or weird cramping, let me know. Cramping's okay. It's your body telling you, I don't really understand this position, but I'll try to figure it out.
Friendship is good.
Is it painful? No.
So pails contraction in 3, 2, and 1. Start driving the knee, ankle into the ground. Create that tension. You've got 6, 5, 4, 3, 2, 1. Ease off. Try to get further into the stretch. And then in 5 seconds, you're going to think of driving your knee and ankle off the ground. So in 3, 2, and 1. Start driving it up. Yep. 5, 4, 3, 2, and 1. Perfect. So now we're going to come up a little bit. Before we get to the other side, what we're going to do is you're going to drive this knee as high as possible without this knee coming up and back down. So you can either have your hands here to create tension, hands here as kickstands, or you can lie back this way. So what I want to see is 5 knee pumps where you're really trying to drive the knee open, and then on the 5th one, you're going to roll over to the other side like a ninja. Yeah. When you get to the other side, we're going to do the same thing. So we're going to tilt that pelvis, lean forward, and hold that stretch. How are we feeling, everyone? There you go. So remember, the more you can stick your chest out and arch your lower back, the more you'll feel it. Any cramping? No? Oh, good. You guys are advanced. So we're going to go another minute or two. So we're going to do that pales and rails contraction. So in the rails contraction, a lot of people make the mistake of, because they're thinking of pulling the leg in, they kind of lean their upper body back and they lose that gap. So as you're pulling that leg in, think of driving your chest further down if you can. So in about 20 seconds, you're going to do that pales contraction where you're driving the knee and ankle down. So we're going to start in 5, 4, 3, 2, and 1. Start driving the knee and ankle down, creating that tension throughout the entire body. You got 5, 4, 3, 2, and 1. Try to get further into the stretch. And now we're going to do our rails contraction, driving the ankle and knee off the ground, starting in 3, 2, and 1. Start driving the leg up, drive, up, up, up. Create that tension. You've got 6, 5, 4, 3, 2, and 1. So now we're going to come up. We're going to do the same thing. We're going to do those knee pumps for 5. After 5, we're going to roll over to the other side, and then I'm going to show you what we're going to do next. It just gets better and better. Yes. Yeah, so again, hip structure, right? It all is connected together, and this stuff kind of attacks it right away. So this would be actually a really good warm-up before squat day or any kind of leg day. So what we're going to do now, with the trailing leg, when I tell you to go up, I want to see this, and you're isometrically holding that. When I tell you to go down, that's when you go down. So it's going to be a lot of like Simon says. If you cramp, it's going to be super embarrassing, so like go legs straight out and just rub it, and then you go right back into it.
How do we lift this up?
So it really depends on the person. So a couple options. Hands here to create tension, lift, hold, hold, hold. Hands here as kickstands, hold, 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 hold. If it's really hard, elbow down, hand on the hip, lift up. All right, so in 3, 2, and 1, drive that leg up. Hold, 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 and relax, and up. Again, hold, 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 hold. Back down, and yes, oh well, the ankle. And up one more time, hold, 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 and back down. So the next thing, again, hands here, elbow here, depending on where you're at. When I tell you to lift, you're going to lift the ankle and knee up and isometrically hold, hold, hold. So you were doing the ankle only, now we're doing knee and ankle at the same time. All right, so in 3, 2, and 1, lift, hold, 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 and back down. And lift, hold, 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 back down. And one more time, we're lifting, hold, 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 and back down. So let's do the same thing on the other side. We're going to rotate nice and slow like ninjas over to the other side. Get into a comfortable position, and we're going to start with that first one. We're just lifting up the ankle. And up, we're holding, hold, 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 and back down. And lift, hold, 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 back down. One more. And lift, hold, 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 and back down. So second layer, we're lifting the knee and ankle up at the same time. And up, hold, 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 back down, and lift, hold, 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 back down, and up, hold, 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 back down. So let's transition to the other side. We're going to do one more thing. So we're going to do some end range stuff and some lifts and all that kind of fun stuff. So ideally what I want to see, we're going to take our trailing leg into a butterfly position. So what we're going to do, again, hands here, kickstands here, whatever you got to do. You're going to lift the leg up like we've done before. You're slowly going to rotate it into a mini butterfly position. And then you're going to come back by leading with that ankle and coming back. What I don't want to see is when you're doing it, you're like, yeah, totally. Like, and you're just all over the place. The slower, the better. So if I go through this, it's going to take me a while to make sure I'm not cheating at all through the movement. And again, depending on where you're at, if you have to go on the elbow and lift the leg nice and slow, then you can do that. So find where your level's at. We're going to do 3 on one side and then 3 on the other. So on your own time. Whatever you want to do. Yep. So what you're going to do is you're going to lift the leg up and nice and slow. It's almost like a window wiper kind of movement with the leg, going into a mini butterfly position. Right? The slower you go, the more information you send to those hip sockets, which makes them happy. Breathe. So kin stretch, how I describe it to people who have not experienced what you're experiencing, is like stretching on steroids. Essentially, this works on every weak link in your body to kind of make you more bulletproof in the gym and in real life. Yeah. But what we're trying to do here is kind of bridge the gap between active and passive range of motion. So the kind of thing that I always show people is like, my active range of motion of my trailing hip for internal rotation is this. Passively, if I lift, like I can get there, but I have a gap. So I need to work on this a lot more to bridge that gap. And that's going to help me a lot.
So that determines what your potential mobility is, right?
Have we done 3 on both sides? No. All right, here we go. Other side. So now if you're in that 90-90, you're nice and slow going to go to the other side. And then same thing, we're lifting and rotating the leg in for 3. If you really wanted to challenge yourself, you could bring out yoga blocks and use them as like little barriers where you have to lift over top of the yoga block and really challenge yourself. It's good times. Did you do 3 per side?
I did.
Oh, awesome.
I started early while you were filming.
Okay, good. So after everyone's done 3, we can go back to the wall and see if that changed anything. So a lot of times when you've been sitting all day, been inactive, you haven't been sending a lot of information to your hips, this tends to make it feel pretty good.
We've been talking anyways, it's saying there's a party going on down there.
Using your hip joints.
I definitely using them.
Which is fantastic. Shows you.
That was a big difference already for you.
It just feels.
Yeah.
Feels like new hips.
Yeah. Go one more because you came up a little bit too fast. I was waiting for your gap. But again, this stuff like kin stretch depends on the person quite a bit. So, for KP, he had a huge difference. But again, like every person is an individual, right? So maybe for KP, 10 minutes is all he needs. Maybe somebody else needs like 2 times a week at 40 minutes doing this stuff. And that's what's going to make a huge change, right? But again, it's like what the goal is. Like, what are you trying to achieve? Do you want to achieve more mobility and stability so then when you do squat, you kind of own it a little bit more? board, you just want to move and feel better a little bit. So like things like doing cars and maybe just one set of pails and rails, kind of like, okay, that feels good. Now I can go up. But maybe let's go into the squat racks and start back squatting. Any questions before we move on though? No? Okay, so let's hop to the 2 squat racks that we got right now. Whoever wants to go first, set up into your back squat, and let's see what we're working with. So if you have to put weight on, that's fine. Because I find sometimes if you go with just the barbell, you kind of have to, yeah. So does anyone have questions about the barbell back squat? Then that would be kind of the conversation opener for this thing. No? Okay. Sorry?
I'm moving Sorry.
So there's different weights in the barbell. So like the barbell itself is 45. But we have ones that are as light as 25. So there's certain things that need to be achieved in the barbell back squat. First being having enough flexion on your shoulders. A lot of times it's usually guys who used to be studs in college and they come back to the gym in their 40s because they realize they've gained like 30 pounds and they haven't moved. They still think they can do this, but because they've been inactive, the lame joke that I always say is if you don't use it, you lose it. And essentially the mobility of your shoulders, your T-spine kind of disappears. So then getting under a bar, they'll end up kind of looking like this. And now they kind of like the arc of the angle of where the weight goes is going to be like kind of over here. And back up and down, they're almost doing like a good morning. So for the barbell back squat, it really, really depends on the individual from where they place it on their back, how wide they go, how close they go, again, how we were working on our hips, what your stance is. So find a comfortable stance first, do a couple reps, and
Why don't you do body weight?
sure. So let's start with the body weight. If you've done, who's done barbell back squats here, first of all? Okay. Do you want me to just take the barbell? Yes, sure. Do you want me to take the barbell people and then you can work with the body weight? Yeah. Set up and ready to go.
Maybe.
Let's just see each other's body weight.
No, but we have.
Like, I'm not too worried about the butt weight on you,
So I'm here to see that.
because you're kind of the exception to the rule. Like, that looks like a really good squat. How does it feel?
Yeah, it's good.
Yeah. So that was kind of the one thing that she noticed when we were doing this little test. Like, she's like, oh, my hips feel better this way. Oh, now if I rotate my foot out, that's going to make me feel better. Now that she knows her advantages. The only thing, like, if I had her decline, what I would tell her is when you're holding the barbell, because what I want to see is full body tension. Yeah. So when you squeeze the barbell, I actually want you to think of pulling it down into you. Right? It kind of sounds counterproductive because you're trying to come up, so you're like, I should be able to push it up, but that's not going to feel like right in the shoulder. So when you kind of pull it down, you lock it into you, now you got this joint. Because a lot of times when people lose the back squat under a heavy load, they get to the bottom, they come up, and they go and break. And that's going to fuck up your spine essentially.
It's like a little bit, but it's okay.
So for you, it's like constantly thinking about creating tension, because again, this is light load. It might look a little bit different when we place like 135 on the bar and you're trying like 1 to 3 reps. So things like tension and also breath work. So what I want to see is taking a deep breath, holding it for a second, and then driving out of the hole as fast as possible.
There you go.
Deep breath on down.
Taking a deep breath in on the way down, and then on the way up, exhale as hard as possible.
There you go.
How does it feel on your traps? Okay. So that's another thing. You can also play around with where you are. So typically what I tell people to do is like the biggest
part of your traps that has a lot of flesh. That's where you want to sit it on. And there's also something called a low bar back squat where they'll put it down here. And that makes a difference when it comes to heavier loads, right? Like, this goes back into like powerlifting, but again, like you need really good shoulders to be able to do that. Yeah, so it always depends. If someone has really good shoulder mobility, then they can try doing low bar back squats. Also the height. Gotta always make sure the height's okay. So let's go wider with your feet actually. Close it a little bit more. Squeeze tight, pull down the barbell. Right about there. So that depth that you just did, do like an inch higher. Right about there, yeah. Yeah, so like she had a butt wing pretty quick, but again, like she's barefoot, so now she's really challenging her ankle mobility. Right about there, right back up. But again, do another one and pause there for a second if you can. If you look on the side, like that's a pretty good depth with no heel lift, no nothing. Like that looks like a pretty good squat, and that's where I would tell her to stop, right? And like an interesting thing too is like someone like Camila where she has this depth. Sometimes what you'll see is when people get down there, they don't have enough core or stability strength to actually get out of it. So sometimes like what I describe, like especially like dancers, cheerleaders, yogis, they kind of have a body that's a Ferrari with no brakes. Like it can perform really well, but when you're asking to cut a corner at 100 kilometers an hour, there's no interval. That's where the injury will happen, right? Whereas on the flip side, when someone's super tight, like now you're putting mobility on top of it that you can work on. And it's like this is why exercise is such an individual thing, because one, we're talking about hip anatomy, maybe the knees, maybe the ankles, now stability comes into play, now mobility comes into play. Like there's a lot of pieces to the puzzle for a good looking squat.
Yeah, so butt wing with the wider mat.
No, like where you were kind of stopping was kind of like perfect. But it's like if someone wanted to squat to that depth to like ass to grass, you could, but it's like risk over reward. If you're trying to get into Olympic lifting, you would kind of want that to your advantage. But again, it all depends on the goal. You can put weight on there. Try doing a little bit of like wider with just your knees. Yeah. Okay. And then turn your toes out a little bit.
Yeah, and then turn the toes and just
That looks better.
better. That's a good.
That is good.
But usually if they go heavy, that just kills the motion. Never works.
Now we're
Yeah, so it's like when I see people on the heavy load, so right now we're doing barbells and lightweight. What I'm more curious about is when we place a load that's like 70 to 80% of your max, things change a lot, and you'll see those weak points. You'll see stuff where people get to the bottom, they look really good, and they'll come up and one side and back up. And like that's an exaggeration, but when you see that, like it might be a small little thing like that and it looks kind of fine, but over time it's something to consider that maybe that right hip is shifting over because something down the chain or up the chain is weak, and over time it's going to make it worse. And then now, 3 months down the road, you're like, why does this side of my low back hurt, right? I've seen other things where people have tight hamstrings and they get to the bottom, they look good, and they come up this way every single rep, and it almost becomes like a good morning, right? Same thing if people are tight up top, that kind of tends to happen. Things like knees buckling when they're under heavy load. Again, those are like weak points that you need to work on. And a lot of times when you want to get better at back squatting and deadlifting, it's single leg stability that I want to see improve. Because when you think of the best powerlifters in the world that are like squatting 600, 800 pounds, when they get underneath the bar and they go 1, 2, 3 to get ready, they're at one point on one leg with 600, 800 pounds. So this, and this has to work really hard, and they're really proficient at it. So the best powerlifters in the world are really strong on one leg. So a lot of times if you hit a plateau or something feels off, you switch your program to more single leg stability and single leg strength. That clears up a lot of stuff. Questions, thoughts, concerns?
So how does this portray over to like a goblet squat?
Yeah, so my thing is like when this becomes really difficult for like a brand new person or someone that's been lifting for a while and just this doesn't feel right, I would prefer to see them doing variations to still get strong. So, you know, when I see people in the classes struggling with this, I would throw them into a goblet squat. And again, it's like, I haven't seen anyone in the classes throw the 90-pound dumbbell on and start doing it for reps because it's fucking hard. And then like, if you get strong at it, now you can play with tempo. Like, imagine how difficult it would be with a 90-pound dumbbell in front of you going 1, 2, 3, 4, and then hold 1, 2, 3, 4, then drive up. Like, that's going to make you strong. Like, say if you hit a plateau there and you went to a goblet position for a while, whatever your weight is, it might not be 90 pounds, but say it's 50 pounds. That's going to make a huge difference. That's kind of going to make you bulletproof. Or simply using the barbell into a landmine position, still loading it pretty strong. Like, there's always other exercises to get you strong in the back squat position, even if you have an injury, have some sort of limitation. Is just learning what it is.
Well,
and then,
something we haven't even touched on is what the core is doing during this, right? So sometimes people that don't understand the link between what's going on here and what's going on here, you throw a weight in the front, they have to hold that weight in front. So these muscles automatically have to turn on. So it's almost like a really good test to see how much does my core impact my squat. Like if I'm like struggling with my squat and throw a weight in the front and I'm that much stronger, I've just turned on another system to help, right? And this is obviously important, but it's also
yeah, like a lot of times when people, like kind of what I was saying earlier about when they come up to the squat, they kind of collapse here. Like I'm also kind of curious, what are they doing for core work? Are they laying on their back doing crunches, getting back into this position, and now they kind of force themselves always to go in this position because they're so strong that way? What about getting them strong here, doing strong carries, strong things like that? Or actually using core exercises that help you stabilize your spine under heavy load? Because that also translates into real world if you're going to go pick up your kid with rotation, and now you're strong enough to take that load without any kind of compensation, right? So it's a big picture, right? So that's why I spend a lot of time programming for clients to figure out what's the best way to make people improve their life. So I look at general population people as pro athletes. My job is to make them move and feel better so they can play at a high level at their sport. Their sport is life. So being able to run around after your kids and grandkids is probably a huge outcome for someone compared to like, I want my back squat numbers to go up. That's a pretty cool end, but questions? Is there anything you guys want us to cover? So we're kind of near the end here, or over time, but is there anything that we haven't covered that you were wondering about, or got any specifics for yourself?
Are you still driving short? Just with your feet to squat too, or just center?
You can, right? And again, this goes all, like every question I get about fitness and health, it always starts with depends. If that makes you more engaged to the floor and you're more grounded and you feel like it's helping you, 100%. If you listen to a DMX song before back squatting and you think that's making you squat heavier, 100% do it. Like there's a lot to it, right? Like there's a psychosocial aspect to lifting heavy too. One of the coaches I know down in the States, he trains a lot of college football players. When they do maxes with all their players, it's one kid in the middle and the whole team watching and cheering him on, and they don't tell him what the weight is, and they just go. And they have higher numbers because of that. But there's small things like that that make a huge difference. Yeah. Anything else? You might just like wrap it up. I don't know. We were kind of bouncing around. Yeah, we want to do shoulders. We also want to do a seminar on how to rock tape yourself and someone else. Yeah, so we would like include a roll of tape and to cover the cost of that. So you pick her.
Here, I got a rock tape.
We're gonna do
It's one of those things where, like Sarah and I were chatting where, say you rolled your ankle over the weekend and you can't see one of us until Thursday, at least you can rock tape your ankle to, get by and then you can come see us. But I think it's a good tool to have when used appropriately. But shoulders and rock tape for sure is going to be one of the things in the future. Yeah. Alright. Snap a picture before we leave.
Saw that coming.